Good evening, ladies and gentlemen, to this gala dinner of the Indo Global Healthcare Summit and Expo 2014. Today we have with us Dr. Usha. I'll kindly request you to kindly introduce yourself, ma'am.
I'm Dr. Usha Chedalawada, Professor Preventive and Social Medicine, Public Health in Siddhartha Medical College, affiliated to Dr. NTR University of Health Sciences.
I have a question for you. Since this particular Indo-Global Summit is bringing all the entities of the healthcare fraternity, it is bringing in more than 100 years of cumulative research work. They are bringing in professors, doctors and researchers. According to you, what are your expectations regarding the outcomes of this particular summit?
This platform is giving an opportunity to discuss on diverse topics relating to health from womb to tomb and relaying that to our applications for our communities or populations that need this kind of services. And what I foresee for this is this is a unique event of its kind, wherein the intellectual entities across the world done at micro level are brought onto the macro level platforms which can be emulated across the globe, which is what I call it as a equitable distribution, appropriate technology for the world.
We would also want to know one final thing, since you also mentioned regarding the micro level being emulated in the macro level of certain healthcare services. Now, since it is assumed that a bulk of the population, since we are talking about India as well, actually they cannot access proper healthcare, since given the costs of healthcare, it makes a huge hole in the common man's wallet. So how far is this summit, the advances and innovations are likely to address that problem?
That's exactly the reason why we feel the innovation and advances that addresses the needs of the community, which I formally said, is what we are looking at. The needs of the community, what a person can pay for. We can be emulating the healthcare systems that are already proven successfully in countries like Canada, China, etc. That can be emulated in our countries, and that's exactly those recent advances and innovations that could be emulated, that's are feasible for our Indian economic scenario, is what we are actually looking for. And those are the projects which are by and large funded. That is what is called sustainability of and viability of innovation. So that is what is working on micro level innovation for macro level applications of the health knowledge acquired.